What's up, everybody? Welcome back to the channel, The Pitt, Season 1, Episode number 9. This is the 3 p.m. hour, and I feel like I'm going to say this a lot in this show, but we're coming off of one of the most brutal and emotional episodes of television that we have ever watched, and as parents, it's just unfathomable, unimaginable, just can't even wrap my head around the idea of your 6-year-old drowning and passing away, and that was so hard to watch. And just, again, like Mel being the absolute rock star that she is, talking to the little sister, Amber's sister, and like
I'm trying to hold it together right now.
Yeah, it's a very difficult thing, and it's very emotional. And this show, like, as parents, there's a lot of stuff that's already been presented in this show that is very difficult to watch. I feel like this show has something for everyone that makes everyone feel uncomfortable.
Oh my God.
It doesn't matter who you are, how old you are, like where you come from. There's something in this show that is going to upset you because this show is just got so much stuff going on. There's so many things playing out and happening every episode, which is technically a full hour of their shift. And I mean, the honor walk with Nick, well, I mean, that's a storyline that has been soul crushing as well. So emotional, so upsetting.
Because I feel like it could happen to anyone.
Yeah, and it can. It does all the time.
Things could happen.
That's the
to
horrible
anyone.
part about. That's the horrible part of that reality is that this stuff happens
like you
all
think
the
you're
time.
just taking a little something to, like, you know, keep yourself awake so you can continue studying.
Yeah.
Die.
It's
Everything
so
is
insane.
so fragile.
And I mean, you're seeing all these emotional cases show up and be handled, and the crew is dealing with their own stuff. I mean, the fact that Robby is working on his mentor's anniversary of his death, that is tearing him apart. He is struggling. He has not been good mentally from the moment he arrived, and we are into 9 hours of this shift now. And it's just one of those things to where things just keep getting worse. Dr. Collins, who is pregnant, lost her baby. Like, there's so many things. Yeah. It's just, there's so many things. And it's like, these people have one of probably the most stressful jobs in the world. And they've got to be able to push their own personal stuff aside so that they can focus and save lives. And they've lost patients. We've lost a handful of patients so far in this first season. And it's like, not only are you dealing with your own personal stuff, but you're dealing with the potential loss of someone that you couldn't save. But it's like, you got to go to the next one. You got to check the board. Okay, I'm going to take, like, you just got to move on. And there's been conversations about that. And Robby's like, it's just, you don't. You just got to find ways to keep going forward. But there is no way to get over it because you can't. It is too emotional. It is too impactful. I think it's also part of the reason why they talk to each other the way that they do. Obviously, things are a little bit more like this right now just because of the way, and I think the core of it is Robby. Robby's been very snippy. He's obviously not feeling good because of what day it is. And he has responded to certain people. And it's created a very kind of walk on eggshells environment currently, it seems like.
True.
And then you have like a character like Santos, who she's clearly carrying her own stuff, her own issues, and how she handled the situation with the dad who was in the hospital with the mom and the daughter. That whole situation, the way she handled that made it obvious that that's what her personal trauma is. I don't know if that's true. I'm just making that assumption based off of the way she responded, because she specifically was like, I know men like you.
Yeah.
So she has dealt with this, and that obviously set her off, as it would anyone who's been through anything like that. I'm just curious to see what these ramifications are going to be potentially from that. What is going to happen?
I just worry, like, you want bad people to be caught and be, like, put to justice accurately. And I just worry that, like, some of the things she said or did might impair the ability of, like, officials to, like, prosecute or whatever they need to do to him.
Very potentially, absolutely.
One of the things that's what I was thinking. I think about certain things about this show, and thankfully my brain is like, forget this part, forget this part, and forget this part, but don't forget this. Like, my brain is like, forget about the death stuff, but like focus on like the baby stuff, and it's like the miscarriage and like her going after if he's a piece of shit, then like remember that stuff. But like thankfully my brain is like trying to save me from the baby death stuff.
One of the things that we talked about that is probably the most difficult aspect of what they're dealing with, when you're presented with a case like this, you have such little information.
Yeah.
You have literally just the surface of what you could be told, because one party, I mean, we've seen people show up with not even serious injuries lying about certain things or not revealing truths about who they are or what the situation is or whatever. Like, you see people not giving all the information up. And when you have something serious going on, they have such a small percentage of the truth that it's hard to even act off of that kind of thing and know what is real and what is not. What is the truth? What is not the truth? Is it somewhere in the middle? Like, it's so hard because they're presented a certain thing.
Yeah.
We have no idea, specifically with this family situation, we have no idea what their family dynamic is. We don't know if this mom is just trying to do something else. We don't know if it's true that the dad is doing inappropriate things. Like, we have no idea. There's no way of knowing because you don't have the full story. And that's the difficult part for like Santos in her situation, is she jumped to the conclusion because she was struck personally with the idea of this happening. Well, and so she acted on it.
You absolutely need and want to believe a victim.
Yeah,
absolutely.
Of course.
There needs to be
especially
more information.
When it's something like that.
Yeah,
so,
and I need to know.
Yeah.
Are you a piece of shit, or do I need to rethink this whole thing?
Yeah, it's just a difficult spot because, again, you're given such few details about the whole story. But here we go, 3 o'clock hour. You ready for it?
Yes.
Let's go. Hour 9, 3 p.m. to 4 p.m.
Can you just put him on the phone for a second?
Oh, I've been meaning to bring this up.
There's my guy. How you doing, buddy? I would love to hear your song.
Santos calling out the idea that he might be stealing drugs.
Oh.
And he might be using somehow. That's an interesting thing to keep an eye on.
You should go home.
Well, that is the last place I want to be.
You sure you shouldn't see your OB?
I checked myself. Uterus is empty, barely spotting now. I'm fine. Oh, I shouldn't have bought that fucking stroller.
Fuck that fucking stroller.
Losing a kid is hard on everybody.
That's as hard as it gets. We do these debriefs to try to give a sense of closure. Difficult cases so that they won't linger. But trust me, the kids you'll lose will linger. So what do? I did my residency at Big Charity in New Orleans. Day one, I got a kid, 5-year-old boy, accidentally shot by his brother playing with dad's gun. Worried he was gonna get in trouble right up until he coded and died. Then I asked myself, like, what do I do with this kid? Where do I put this feeling? And I found myself walking all night. I found myself back at the gates of Big Charity Cemetery, and I'm looking at all those mausoleums. I just need a safe place where I can put these feelings.
We got patients throwing punches in chairs.
Okay, everybody, let's get back to it. Just remember the Employee Assistance
God.
Program is available, as are Kiara and myself, if anybody needs to talk.
Like,
Is everything all right with Collins? Something's bothering her. I asked her about it. She said she doesn't want to talk to me about it.
Imagine that. She probably learned it from you. You just gave a speech titled How to Literally Bury Your Feelings. Now, Phil, excuse me. I gotta break up a fight.
Control your wife, man. Shut
up, man. There's a room full of bad people in here. Hey, how hard is it to put a mask on your kid? He has allergies, you fucking Fauci zombies. Allergies.
oh, shit.
That's enough. What do you people think you are? This ain't Philly. This is a hospital, for Christ's sakes. What's the matter with you? You call yourselves adults?
I love Dana so much.
All I did was offer to put a mask on her child who's been coughing for over an hour. Masks are bullshit. And B, it's an allergy. He's allergic to
How about you don't fucking worry about other people's children and just move seats?
What happened to the tooth? Did you swallow it?
I don't think so.
Oh,
It's still
fuck.
in my hand.
Sure is. I hope you both have all your shots.
Yeah, you don't want to swallow your tooth because that could end up having real issues.
Whoa, she really tagged you.
Red's got a left hook like Billy Conn.
Well, let's get you cleaned up. Come on, baby.
Holy shit, dude.
Excuse me, sir. You're not allowed back there.
Unless what? I start a fight? Become homeless? Apparently that's what it takes.
We see patients by severity of need. As soon as we have your tests and labs, you will be seen.
This place is fucking unbelievable.
Is there nowhere else to go, or?
Type 2 fracture into the dentin. Seal with dental cement.
Oh my god, dude.
You handle Spinks while I check on Ali?
You got this? Don't we, partner?
Totally got this.
How we doing in here?
You should write that bitch a script for calcium because I didn't even hit her that hard. Too much almond milk in your soy latte.
Dude, just shut the fuck up.
Yeah, most commercial almond and soy milks are fortified with calcium, so they end up having a higher percentage of calcium than cow's milk.
Bitch.
Thank you, Mel.
Pluck it out, stitch me up, and send me home. I've got to get back out there to my kid.
Afraid it's a little more complicated than that. You got yourself a fight bite. First, we need to determine if the bite extended into the joint space. If it did, you're gonna need IV antibiotics and a trip to the OR to see a hand surgeon.
An operation?
Well, you're just shouting a minute ago about infection. While I am sure you are in the clear for rabies and HIV.
Oh, shit.
There she blows.
Are you serious?
That's
You hear
your
that, you
fault.
fucking bitch.
No, you.
Yeah,
threw
you
the
punched.
punch.
Yeah, you punched her.
Call the OR. Tell them we have a fight bite that needs to be washed out. Then go take 20 minutes in the lounge. I'll come find you if I need you.
Well, I don't need a break.
Yes, you do.
It's just so much easier to mind your own business.
Tell the surgeons to go no mask. Those of us who save lives for a living believe strongly that masks minimize risk when it comes to spreading disease and infection. But I want to respect your beliefs. So what do you think? With or without for surgery? Without?
I want with.
Good call.
You.
Yeah, let your medical professionals wear their masks and take care of you.
Pitfest OD. Keely Ralston brought to the first aid tent at Pitfest with altered mental status and fever. Temp too high for a field thermometer.
We gotta cool this lady down.
Get some ice packs, head, neck, groin, send off a rainbow.
Wow.
132 BP 2
I didn't know that
120.
Jesus, that's high.
4 of Ativan in the field.
Oh my god, this poor person.
4 more of Ativan, please. Hypertension and tachycardia from MDMA, centrally mediated. Ativan is the drug of choice.
Holy shit, dude.
107. You're killing brain cells. Oh my god.
That's why they got her that ice bath.
I'm a part of the street team here. It's a group of doctors and nurses who go out in the community and help people who can't or won't ask for help. I think you need some help.
What are you talking about?
If you're in trouble, we can help you.
I'm not. And if we're done here, I think I'd like to go.
There's a list of resources on the back.
I don't need that.
If you could just take my number. How about taking the pen? If you ever feel unsafe or in danger, call this number. It's a national hotline. There's somebody on the other end 24/7.
I like that. It's not on the outside of the pen, it's on the inside of the pen.
1, 2, 3, gentle.
This
gentle,
poor girl.
gentle.
Oh my god.
Then we have splashdown.
You think you're having fun? I'm not.
How long does she need to stay in the ice, Dr. Santos?
My PB in the ice is 13 minutes.
Dr. Santos.
Until her temp is normal.
Pull her out at 102, otherwise we could overshoot and cause hypothermia.
Heart rate 120, pressure 198/116.
Oh my
Why
god.
is she on the ice, Dr. Santos?
To bring her temp down.
State the obvious, yet still don't answer the question.
The quicker we bring it down, the less of a chance for permanent damage.
Damn, he's going after her.
Is she sweating?
Profusely.
What if she wasn't, Dr. Santos? What if she was dry as a bone?
Then we'd have to think anticholinergic overdose, not sympathetic.
Very good.
He's pushing her because he sees something in her that is good. Because you're not going to push somebody that isn't worth a shit.
I found you scrubs that should fit.
Oh, thank you. That's great. I appreciate that.
But they come with a catch. Mr. Kokosch's asking to see you.
The guy who peed on me? Why me?
Maybe you should wait to put these scrubs on until after you've...
That's a good idea.
Oh no.
Oh my god.
She does not do well with rodents. That's okay.
Most people do not.
Rats are so sweet, though. The ones that you raise that don't have any diseases.
Double trauma at the back door, auto versus pedestrian before hitting the telephone pole.
Oh my god. What the fuck?
Walter Purnell, 52, walking his dog in the crosswalk, got struck by a Chevy Impala at low velocity.
Oh my god, oh, Bubby.
Whoa, major road.
Oh.
Yeah.
I slid for a good 10 feet.
Who's your friend?
Oh, this is Crosby. Thankfully barked and warned me, so I had half a second to try to move out of the way.
Crosby, you're a hero.
Take good care of him.
Can he stay with me? He's
That's
a very
so
good
sweet.
28-year-old lady had her seatbelt on, clipped the guy with the dog, and went straight into a telephone pole.
What's your name?
Paula.
Paul, you in any pain right now?
Yeah, I got hurt.
Witnesses say she was driving erratically before the crash.
Heart rate 116, BP 180 over 110.
Better,
This
but
poor
still
girl.
too high.
Oh my god.
For Ativan.
That'll make 20.
Good counting.
See, I don't think it's pushing because he sees something. Because that comment right there is not driving someone or pushing them to be better.
Paula, do you know what today's date is?
How about the city we're in?
It's bruising on the chest.
Oh, shit.
I don't think she needs intubation. Might just be concussed.
Worry about her crumping in the scanner.
She's protecting her airway. I see lung sliding, no pneumo.
With a head injury?
Stop fighting. Make a decision.
Paula, can you raise your right arm for me?
Good sign follows commands. Pan scan, head to pelvis, EKG, troponin, straight cath urine for UA and tox screen.
Agreed. I'm on it.
Yeah, he hurt himself.
It's a 10-day course of doxycycline, 1 pill twice a day. I can give you your first dose now, Piper, if you like. That'd be great. I need Piper to answer that one.
Sure, that'd be great.
Come bearing gifts, everything you always wanted to know about STIs, but never wanted to read.
I think we're good.
You sure?
Mm-hmm.
If you change your mind, comes with the free pen.
Thank you both so much for your help.
Yeah.
Thanks.
It's like if she's unwilling to say anything, there's nothing they can do about it, right?
Yeah, she's an adult. You can't force her. You can just provide the stuff and hope to God she says something.
Okay, so I need to talk to you about something.
About what?
Do me a favor. Don't turn around and just walk straight into... I told you not to turn around.
He tried. He tried.
Laughing, but he's laughing.
He tried.
Oh, shit.
Hi, it's Dr. McKay again. Can I come in?
Oh, they left.
Well, it's a long shot anyway.
She took the pen, didn't she?
I took a pen.
Why is she seizing? Her temp is down. Maybe she needs more Ativan. No, she's had 20 already. I don't think this is a CNS problem. She needs saline, low sodium, hypernatremia. We don't know her sodium levels. Just drop 100 cc's of 3% and have it ready. What are you doing?
It's hypernatremia. Serum sodium is critical, only 112.
Knew it. Okay, I'll push the other 50 cc's.
Holy shit.
Why did you not come get me? Hello, I was across the hall. I was 30 feet away. What did she had already?
It's hypernatremia. We pushed 100 cc's of 3% saline. That did the trick.
Why did you not come get me?
It was my fault. Wanted to keep going with Ativan and Keppra, but Dr. Mohan had an excellent idea to treat for hypernatremia even before her labs came back.
Good call, Dr. Mohan. I am going to take that minute to try to instill in Dr. Santos a very clear understanding of what her role is here and how she's expected to function.
Dr. Langdon.
Dr. Santos. You have enjoyed that title for what, 90 days? Is it hubris or ignorance that makes you think that you know more than other residents that have 2 to 3 years more experience?
This ain't it, buddy.
Stupid or arrogant, you need to realize that you are a beginner, which means your job is to shut up, listen, and learn, because so far today, the only thing you have been successful at is proving repeatedly that you know nothing.
Dr. Langdon?
Oh, shit.
Is the patient stable?
Temps 1 and 2, just about to take her out of the ice.
Proceed. Dr. Langdon, a word, please.
Oh, shit. Yeah, that... She might have like an attitude thing, but that was definitely not it.
I can give you a list of
Stop
She was giving
talking.
unsupervised.
Knock it off.
Shut the fuck up.
Where does it say that shaming, belittling, and insulting are effective teaching tools? Harassment has zero educational value. I've been watching you ride her. This kind of behavior will not be tolerated. I don't want to see it.
I'm sorry, it won't happen again.
You are senior leadership here. Step up and act like it.
Yeah.
I mean, sometimes we all need to be checked.
Yeah, 100%.
Like, sometimes we just forget where we are. Oh, he's in all of it.
Prepared.
Better safe than sorry.
Sorry I took off like that. I have a thing about rats and cows. Totally freaked me out.
cows. Interesting.
Yeah, interesting.
They're pretty harmless.
Let's hope Mr. Kokoja is now too.
Yeah, no kidding.
Hey man, I just wanted to say sorry for earlier.
That's really nice.
I kind of go out of my head when I'm off my meds. Then I guess I piss on people.
I'm pretty sure the meth doesn't help.
I'm not using it anymore. I take antipsychotics for the schizophrenia I got from doing meth, but I've been clean a year.
Oh, good for you. That's amazing.
Why don't I take my meds? Well, Doc, I'm kind of in between houses right now, living in an encampment on Liberty Avenue. It's cost money. I don't have insurance. Should I go on?
No, that's fine. I'm sorry. Life isn't always easy.
I really am sorry.
It's okay. Honestly, really, it's okay. I appreciate the apology.
That's nice.
I was my least problematic trainee. Technically, you're all pretty green, but you're growing on me.
Thank you.
How you doing?
Better. It's the little girl and the sister's just too close to home.
The things we do are hard. You're a sensitive person. This is a tough place for sensitive people, but we need them badly.
It's true.
Now, if you're ready, I need you. It's a perfect job. It's practically a Zen exercise. I've got 1,000 pieces of gravel that need to be plucked out of a 2-foot-long road rash.
1,000?
Her face.
Can I ask you something? I was just wondering what the nurses do after their shifts.
In terms of what?
Do they ever like go out together?
He's like, you doing, girl?
Personally, I'm all about a long, hot shower, eating some takeout in front of the TV, ideally watching something that makes me laugh.
Yeah, I can see that.
I like the laughing part of the show.
Maybe we could grab a coffee together. Could like help me get the lay of the land.
You asking him out?
No, what? No, I just thought.
I don't date people in the workplace. It's nothing personal.
No, of course not. No, it's not a good idea. No, of course.
Feel like I'm watching a rom-com.
Oh my God, this guy.
Of course, I can finish up my man here.
Great.
She's adorable.
You okay? Spoken like 2 complete sentences in the last half hour, and both of them have made me sound even more imbecilic than the incomplete ones. It's like my parents once took me skiing for Christmas in Utah, and from the moment I got off the plane, I could not catch my breath. I couldn't concentrate. I couldn't get my bearings. And I'm a very good skier, but I spent the whole vacation just like on my butt. But I was like a human Utah.
I love that.
There have been many, many Utahs in your life.
Wow.
I love that.
Hello? Can you hear me now? Huh? Hello?
Sir, what is the issue?
I just want someone who knows something about hearts to tell me what's happening to me. You know, unlike most of these losers, I have insurance. And I pay my taxes, which pays for them to not have any insurance.
Sir, you've got about 5 seconds to change your whole attitude before security and the police get involved.
I'm leaving.
You are absolutely free to go, but if you do, you will be leaving AMA against medical advice. This form states that I have advised you to stay and complete your evaluation, but you are choosing to leave.
I just want to be treated fairly.
We are not back here playing Go Fish.
We're doing our best to help some very sick people. You will be seen, okay?
Robbie's gonna love that patient satisfaction score.
Crazy people.
Oh my God, dude.
What's going on? Car crash, Pitt and Paula just went south.
BP's crashing 84/62, much less responsive.
What is going on?
May I ask why you did that?
You know, I've been on Langdon's shit list all day. Seemed like he was gonna be more upset about us not calling him in than glad that we stopped the seizure, so no reason for him to be pissed at both of us.
Well, for what it's worth, he's wrong. You're very good at this.
Thank you.
I mean, she's clearly very smart.
Yeah.
She just
sometimes goes about things.
Yeah.
Wrong way.
Doesn't mean you always have good judgment in talking to people or dealing with things, but she is smart for sure.
Temp is 102.4.
What?
Okay, we need to assume the worst here.
This is sepsis. Where is it coming from? What's the source?
Urinary tract infection.
She doesn't have one.
She did when I saw her.
Your specimen could have been contaminated this morning.
She was altered meningitis.
She's postpartum.
Endometritis.
We'll do a pelvic after she's stable.
Dude, this is so insane.
Yes.
We have a street team here. Mr. Kokoja, are you pretty much in one spot these days?
Yeah, well, we're on Liberty and they're the Benedum.
We could bring the meds to him?
Absolutely. The once-a-month injection sounds like the easier option. We could just put you on our schedule.
Wow.
Interested in joining that, and maybe I can bring out the medicine myself.
That'd be amazing. We could use all the help we can get.
Thanks, Doc.
That's so nice.
Oh, looks like we have our source. The positive urine this morning was contaminated.
Jeez. The way shit like goes south so fast for some of these patients, and they have to be so fast with their symptoms. And
McKay.
Did she screw up?
Every postpartum patient needs a pelvic exam to rule out endometritis.
You're saying that with 2020 hindsight.
Did you ask about Tylenol or ibuprofen use? Because that could mask a fever.
There was no fever.
Did you do a careful abdominal exam?
It was a quick chair exam and there was only mild tenderness over the bladder.
Perhaps there was something about the patient that made you overlook proper treatment.
Oh.
Her size doesn't inherently make her unhealthy.
Are you saying I was biased against the patient because of her weight?
I raise it as a possibility, not as an accusation.
Wow. I mean, I really don't think that's the case here, but I will look out for it.
Wow.
That is how you give and take criticism.
Yeah, 100%.
It really is great that you want to help out. The street team get cool jackets.
Yeah.
That's really cool that they have
Get it
that.
out unscathed this time.
Yeah, joining the street team, even get a jacket. So.
She likes him, right?
Well, they're adorable, so.
Very cool.
I like Whitaker. Those damn rats. Oh no! Oh!
Drop
Got
it!
it!
Oh shit.
Oh, get it, Bubby, get it.
Damn, Whitaker. What? One down, like three to go, two to go.
Good job, bud. Good job, bud. I mean, I don't like that you killed a rat, but
I mean, you have
their health hazard
Yeah.
in this situation.
Hard at work?
Whoa! What the fuck?
I'll take my chances.
Are you fucking kidding me? Oh my god.
I need to see the next episode.
What the fuck? That guy is a gigantic piece of shit. Fucking punching Dana? Really?
A nurse, a woman, a professional, you piece of shit.
Big tough guy. Wow. That guy's been a problem since the moment he showed up to the ER.
I knew it. There's red flags all fucking day.
Yeah.
He's a piece of shit.
The way he's talking to the one nurse, the guy's a huge piece of shit. He's a really bad. I hope something bad happens to him. Not,
Hope you
some people deserve.
fucking step on a Lego and every side of your pillow is hot.
Some people deserve bad karma, and he is one of them.
Yeah, I hope you
Like,
stub your toe.
Being stuck in the ER
pinky
is not a
toe.
reason to sock anyone in the face, let alone Dana, who's fucking awesome.
Yeah.
So,
The fuck?
yeah. This crew is going through it. There's so many things going on. Langdon's explosion. That shit was like, I was like, in moments where he was kind of like being the authority, it made sense.
Yeah.
Because he's a senior doctor in this group, and specifically dealing with Santos, like she is learning. This is a learning program for them. But what happened this episode with him writing her the way that he was, you kind of mentioned that he sees something in her. I thought that until he was like, oh, great math or whatever.
Yeah, no, and then he
like
starts making shitty comments.
That's a snarky comment. That's not a motivational tactic. That's a put down.
Well, I like how Robby put it. Like, that berating does not teach anything.
No. Like, there's one way to push and motivate without coming across. I mean, as someone who is coached, it's one of those things to where you got to make it make sense. You have to be able to have respect from the person that you're coaching or teaching in this case. And clearly there's like a disconnect in their relationship.
Mm-hmm.
So being tough on them and writing them isn't going to have the desired effect. And clearly he has an issue with her. And I mean, yeah, she's brash. She has attitude. She handles things a certain way, but she's also really smart. And she seems to be right most of the time in terms of dealing with these medical issues. Every time someone puts her on the spot with a question, I feel like she's getting them right. So his outburst, and I mean, obviously she flipped the role of who took care of what and passed it on and didn't take the positive reinforcement from doing the right thing. So she obviously was expecting him to be mad because that's even what he said, that there's no reason for all of us to get yelled at. But that outburst was absolutely uncalled for. That does nothing for anyone, let alone the development of Santos and her moving forward as a doctor. That hurts everyone around, because then it's like, I don't want to deal with this guy. What if I make a mistake? Is he going to blow up on me? Or does he only handpick who he wants to yell at?
Right.
There is a really interesting storyline that has been very subtle, which is why I keep forgetting to bring it up. The drug thing with Santos and Langdon, the fact that she was like asking Mel a few episodes ago to like, hey, keep an eye on his activity, his behavior. She's sensing something in him. I don't know what it is, but she even went to like the medical checkout thing and questioned whether he was stealing drugs. So it's like, that's a really interesting thing to plant a seed on. Yeah. And again, it's been very subtle, which is why I keep forgetting to bring it up. And I've been meaning, every time I watch or edit or review an episode, I'm like, bring this up, bring this up, bring this up. And I keep forgetting. I should have written it down. But it seems like an interesting thing that maybe he's sensing that from her also. And I mean, people clash. Personalities don't always get along.
Yeah, you're not, I don't think you're meant to get along with everybody.
No.
Because you need somebody challenging you or have an opposing opinion. Like, if we were all the same, it'd be so boring.
Yeah,
so, like, you need the differences.
From my vibe, him being in a semi-position of power, because, I mean, he ranks pretty high.
Yes.
It feels like he doesn't handle anything being out of line. If there are procedures and someone's going through something and the student doesn't go and get him when that's supposed to be the procedure, he's going to blow up on that, because he seems like he's very much a order, do things by the book. We have rules and laws and policies for a reason. We follow them. So when someone doesn't, who's below him, he's going to he doesn't handle the discipline well. Or, because we saw it earlier, we saw it with the conversation with Collins and McKay, to where Dr. McKay may have done something wrong, didn't do everything that she was supposed to in terms of her procedure. And Dr. Collins was like giving her correction, and Dr. McKay took it. Mm-hmm. And it's like they both did a really good job in that conversation of one providing discipline, I guess, or correction, and one taking the criticism and being like, oh, okay, I'll remember that for next time.
Yeah.
So it's like, that's a really good example of it. The relationship with Langdon and Santos, that is not it. That is not how you talk or try to correct or try to teach or educate people in the situation. Like, the way he clearly has a thing against her. And I think a lot of it has to do with the way she just kind of carries herself, talks to people.
Yeah.
You know, that could be abrasive to a lot of people. Not everyone gets along with people like that. There are plenty of people who do. And I just think Langdon, I don't know if he's like threatened by her being right all the time with answering questions, or if there's something else going on.
Or like he sees himself in her and like wish that somebody would have told him stuff or whatever.
Yeah, there's a lot going on there. And I don't know. We'll see what uncovers, but I mean,
I'm very glad that they did not linger on Amber's death.
Oh.
I'm very glad that we did not see another crying mom and a little sister who didn't know what was happening.
Yeah.
Thank you for not continuing to shove that in, because I honestly didn't want to see it again.
The conversation of Robby talking about his first day, like that shit was emotional. Yeah, that is very emotional. You heard it in his voice too.
Yeah, and I feel bad that he didn't get to finish like his statement about.
There's always something going on, someone interrupting.
Yeah, so
some emergency rolling in.
Yeah, so you literally can't linger on anything.
No, you can't.
You just have to move on to the next thing. That's kind
of what we talked about in the intro. It's like, I don't know how you manage all of these emotions and these situations, whether it's personal or it's work related. Like, there's so much going on. They're all human beings. They all have feelings and emotions. And it's like, being able to like put that case behind you to move forward and try to save someone else's life. It's really, really amazing that these people continue to do this job, because I was going to say it.
Like the real people.
Yeah. The Amber case is one where I would just be like, there's no way I could do this job. The amount of
That's
people.
why it takes a special person to be able to handle emergency room stuff.
100%.
Good
And
Lord.
it's like, I'd go find a different field where I potentially didn't have to deal with potential 6-year-olds passing away. Because that is just unimaginable.
Why we're sitting here. Because
it's all very, very tough. And Mel is going through it. She's obviously taking that situation very difficult. Yeah, 100%.
There's a sadness behind those eyes.
I do really like Langdon's message to her about you being a sensitive person, but we need people like you. Like, we need you here. I really like that message. He obviously likes her a lot more than Santos, but she was the one who was responsible for talking to the sister, which, I mean, oh my God. Talk about an absolute gut-wrenching situation and just emotions that can't even be registered.
I mean, that's why you need a variety of personalities. Like, could you send Santos in to do that? No, you could not.
Absolutely not.
But Mel, absolutely.
Yeah, like Mel is so good in everything that she has been put into, and it's tough watching her be down and questioning herself and questioning her future, and because she has been an absolute rock star. She is fantastic. She is awesome. Easily one of the coolest, most fun characters in this show.
Yeah, I do love it.
Really like her a lot. And yeah, I mean, all right. What are we on? We're past the 3 o'clock hour into the 4 o'clock hour.
Mm-hmm.
Do you have any other thoughts?
I need to watch the next episode.
Yeah, we'll get to it soon. You guys share all your thoughts. Leave them down below. Have a good one. Bye.